watching Aging Strong, which is sponsored by the Quincy Health Department. Today, I have a guest speaker. Her name is Donna Golden, and she is going to be talking about foot care. She is a specialist in that arena, and she is a nurse practitioner. This whole time with her is going to be an eye-opener, and hopefully after watching this program, you'll have a greater appreciation of what your right and left foot can do for you. Donna, welcome.
Thank you, Deb.
Thank you. So before we start, and I put the slide presentation, what brought you into this field of foot care?
For the past 15 years, I've been involved in a wound and hyperbaric center. I've been the main provider, and the clients that come in have all kinds of lower leg and foot wounds. And what we found through practice was a lot of time their feet have been neglected. Their toenails are long, there's hygiene issues, there's corns and calluses that have never been addressed. They've been wearing improper shoe wear. So we address both the issues with their vascular status, both arterial and venous, and we try to get them in appropriate shoes. In the meantime, we've started cutting toenails, mainly because they haven't been going to a podiatrist or they've had no one to cut them for them. So along the way, I've been a nurse for 47 years. I decided to see what would be beneficial for a semi-retirement position. So I took a course in foot care through the American Foot Care Nurses Association, and there I found that I was able to start my own business called Mobile Medical Foot Care, and primarily I started the program to see elders in their homes. They can't get out, they're homebound, and that has evolved into several senior centers. Also, I've go to several other types of facilities. But what it does is it helps cut their toenails, it reduces fall risk, and measure their feet, get them into appropriate shoes, control edema or fluid in their legs, and all over, hopefully, improve their mobility and balance and all over safety.
Wow, definitely very, very important to have, healthy and happy feet, as they say. So here, I'm going to pull up your presentation and can't wait to learn more from you.
Thank you. So why foot care? Feet are often overworked and overlooked. Anybody who has spent any length of time standing, whether it being in the checkout, Dunkin' Donuts, if you're a police person, male person, doctor, nurse, anyone who spends a lot of time on their feet know how important good shoes are. And a lot of us have experienced painful feet. So the changes in your feet over time can be very subtle. If you wear poor shoes, your feet will eventually adapt to what the shoes that you're wearing versus your foot being in a shoe that is meant for them. Preventative care should start early and be modified as changes occur over time. The purpose of this program is to bring a renewed awareness to the importance of your feet throughout your life and how to care for them. Next. So your feet are actually a mechanical marvel. It contains 25% of the bones in your body. It has 33 joints, 100 muscles and ligaments. It has a vascular supply, both arterial and venous, to feed all this area. It contains 250,000 sweat glands that can produce up to a half a pint of moisture per day. You have 8,000 nerves that are responsible for allowing us to stand upright, maintain our balance, propel us forward when moving and help us regulate our body temperature and feel the ground beneath our feet to shift weight when we need to. Next, the ultimate goal is to keep us mobile. If things do go wrong, it allows us to correct them before significant harm is done, like ignoring chronic pain or wounds that won't heal. Once issues with your feet are discovered, calluses, corns, bunions, special considerations should be put into place to prevent the condition from worsening to maintain your mobility. Next, what is normal foot care? In the most simplest form, checking your feet daily. If nothing is wrong, it should only take a couple of seconds per foot. Think of raising each leg when you are still in bed and looking at your feet. Use a mirror if needed to check the bottoms of your feet. You should check for cleanliness, scrapes or sores that are painful or not healing, and any visible changes. You should clean your feet regularly, removing dirt, buildup between your toes, and reducing odor. Soap and water is fine, and rinse and dry well, especially between the toes. Soaking is out. If you do want to do it, just for the comfort, 15 minutes only. Otherwise, it dries out the natural oils in your skin and makes your skin dry and open to cracking. Protecting your feet with well-fitting shoes and cutting your toenails on a regular basis. If you want to prevent them from getting too long, they may snag on clothing and they may get torn off. You also want to take care of your toenails on a regular basis to prevent pain with walking. Use clean socks and shoes, reducing the risk of developing funguses and foot odor, and using shoes that fit your feet, reduce developing foot and toe deformities, as well as corns and calluses. The other thing that you want to think about is who is cutting your toenails. Are you still, or do you need help? Cut your toenails regularly, straight across. Avoid cutting too far into the corners, which may develop ingrowns. Deb, do you have any thoughts or concerns?
Yeah, I was just thinking about the cutting, the way some people cut their toenails instead of cutting it really like in the square-ish. There, it's more kind of like an arch on the toes, and it kind of goes right into the very sides. I've certainly, seen some people with that, and wonder if they're comfortable with that type of toenail shape, and if that would lead to ingrown toenails. But based on what you're saying, it's best to kind of leave the sides alone as much as possible, and just cutting the toenails so that it's you're maintaining just the adequate size of it, so it doesn't go beyond your foot.
Definitely.
Yeah.
Next. So why is this important? The feet are the furthest away from both our heart and our eyesight. Changes in blood flow, as with respiratory and heart disease, can affect the health of your feet, which shows up as swelling, thickening toenails, and purple toes. Changes in the feeling of our feet can cover up pain from injuries that we can't feel unless we see them. Wearing poorly fitting shoes, too narrow or too small, can affect not only the appearance, but also the function of your feet in later years. With early detection of issues, changes can be made. If you smoke and have blood flow changes, it may encourage you to stop. Foot pain when wearing a particular type of shoe may cause you to think to avoid that type of shoe before it does permanent damage. Think of high heels and dress shoes. Toenails do not stop growing, even if we no longer cut them ourselves, and need regular attention. Next. There are a few changes that occur to our feet as we age. Feet get longer and wider. Why? So It says that we walk over 100,000 miles in our lifetime. The ligaments relax, feet spread out. Changes in weight, pregnancies, activity can also cause this to occur. Diseases and conditions, alcohol abuse, spinal stenosis, diabetes may cause neuropathy, which is decreased sensitivity. Smoking causes changes to our blood flow. It also contributes to fungal toenails. Ill-fitting shoes may cause bunions, hammer toes, corns, and calluses. The thing to remember that if you were a size 8 when you finally were launched out into the world to take care of yourself, you may be a size 9 or 10 now. Also, it's normal to have one foot that's slightly larger than the other. Unfortunately, we tend to buy shoes that fit the smaller foot so that we don't have one foot that's flopping around in a bigger shoe. So that's something to consider when purchasing new shoes. Next. So that brings me to shoes. I will spend some time on this because I think it's very important. We are born barefoot and then have to abide by society's norms by wearing shoes. Luckily, there are far more types of shoes than ever before to fit our feet correctly. It's important not to fall into fashion trends. If you have a wide foot, you'll never be comfortable in a narrow shoe. Choosing a shoe that's too short can lead to curled or hammer toes, while one that is too narrow can lead to bunions. If you look at the slide on the right, you'll see the different shoes that fit the appropriate foot. Not all the shoes are the same. Likewise, in the slide on the left, you'll see how having a slightly more rounded toe area and slightly wider shoe allows the foot not to be cramped within the shoe. Your shoes should fit your feet. Don't try to have your feet fit the shoes. We've all been guilty of it. So the other thing to think about is just because your feet have stopped hurting in bad shoes may mean that your foot has adapted to the bad shoe, which again can lead to corns, calluses, and bunions. Next. So we all have seen the foot measurer at the foot store. It's the metal or plastic device that measures the length and width of our feet. But what if you can't get yourself or a loved one into the shoe store to buy new shoes? You can trace the your foot on a piece of heavy paper with their knee slightly flexed. Then you can measure the length and width and bring that into a shoe store. If there's no outline shown around the sides of the shoe that you place on top of it, chances are the shoe will fit. A half a size larger is only 1/8 of an inch longer. I always thought that it was at least a half an inch or an inch, but no, it's only 1/8 of an inch longer. It's not a lot, but could make a big difference in the way that your shoe fits your foot. Next. Next, I want to talk about common foot deformities. Do you have any questions, Deb, before I go on?
No, I'm just really enjoying everything you've shared. The slide before with the somebody, whose foot was being outlined, it just reminded me of when I was little, when my parents used to do that, and they so they could, even if I was not there, they would be able to find the right footwear for me, So it just kind of, jogged back some memories. So it's great. But yeah, keep going. This is great.
Thank you. So two things that we see a lot. One is bunions. The other are general toe deformities. A lot of people think that bunions are a tumor or a growth on the side of their foot. But you can see from the x-ray on the slide on the left that it's actually the metatarsal joint from the great toe being pushed outward and then the toe being pushed towards the second toe. You can see over time that this could be quite painful. Bunions can also be from heredity. And most of the times they will hurt in tight shoes. If they get too painful, you may need a podiatrist assessment and possible surgical intervention. With toe deformities, you have your typical hammer toe. Your great toe has only 2 joints, and you very rarely see a hammer toe occurring there. But your second through fifth toes have 3 joints. Hammer toes usually take place on the second joint. Mallet toes take place on the first joint, and claw toes are involving both the second and the third joints. Over time, if not corrected, they can lead to corn and callus formation either between the toes or the tips of the toes from rubbing against your shoe surfaces. Next, corns and calluses. Corns can be soft or hard. They are caused by direct pressure over an area, whether between or on the toes or soles of the feet. Think of them as a grain of skin that turns hard and feels like a pebble. They can be quite painful. Corn removers remove the top of the corn, but usually not the root, allowing them to come back if the offending shoe is still worn. Also, if you have a loss of feeling in your feet, commercial corn remover solutions contain acid, which can burn your good skin without you even feeling it. Calluses can occur whenever there is recurrent friction and shearing over your skin. We can get calluses on our hands also, for instance, at the base of a ring you wear all the time on your hand. But usually they're on the feet, on the heel, the bottom of the foot, or the sides of the toes. This may mean that your shoes are too small and not wide enough. Get your feet remeasured. Use skin softening lotions that contain urea. Urea softens dry skin over time. Over-the-counter preparations that contain urea are Ulactin and Lachydrin. If in doubt, ask your pharmacist. Next. Checking your insoles. This can be done by removing the insole or shining a light into your shoes. As you can see, the shoe appears wide enough, as you can see all 5 toes. The toe imprints at the very top of the shoe, which is the problem. This shows that the shoe is definitely too short. Also, the great toe on each foot has been deformed, bending towards the second toe. This person could have a bunion, or it could be that the foot was deformed from the too small of shoes. This person may benefit from longer and bigger shoes. Also see how worn down the insoles are. Next. If your shoe did fit well and there was no other problems, and you didn't need a bigger size, maybe a replacement of the insole would give the shoe new life. Remember to take out the old insole first, as not to cramp the space inside the shoe. Next. When this happens, take an inventory of your feet and shoes and what you are doing. Shoes tell as much of a story as your feet do, both the wear pattern inside and outside. Look inside your old shoes for wear patterns. If you see that the outline where your toes go is cut off, you need wider or longer shoes. Get remeasured. If you have irritations on the tops of your toes, you may need a higher toe box. You also may need shoe inserts called orthotics. You actually may need 2 different size shoes. You may have to obtain special size shoes that are not always available at regular shoe stores. Most shoe stores carry a very limited supply of wide or extra depth shoes. Don't be conned by, "That's all we have," or "They don't make them in your size," etc. Google or research wide or extra depth or diabetic shoes on the web. Some companies that have these special shoes are Dr. Comfort, Ortho Feet, Friendly Shoes, Hitchcock shoes. Next. The loss of feeling in your feet is called neuropathy. There's several major causes: spinal cord problems or injuries, spinal stenosis, various diseases, alcohol abuse, heredity, diabetes. Uncontrolled sugar in your blood damages nerves. The feet have over 8,000 nerves. Not all do the same function. Some control feeling or sensory nerves. Some control sweating or dryness, which are called autonomic nerves. And some control movement, such as your motor nerves. They tell how we feel the surface that we're walking on, allowing us to adjust the way we walk accordingly and help with balance. Next. Which brings me to safety, balance, injury. When you see your medical provider, make sure they check for neuropathy in your feet. They can do this with a monofilament, which is not a sharp instrument. It usually looks like a small piece of fishing line, and it will check whether you have lost the protective sensation in your feet. Once you have neuropathy, you have to be extra careful. Your balance may be off and cause falls. You may not feel how tight your shoes are and cause sores. You need to wear good-fitting shoes. The main thing is not to go barefoot and risk injury. Industry has finally come up with hands-free or slip-on shoes. There are several brands on the market. There's Skechers, Kizik, Orthofeet, and Ziba, to name a few. These shoes you don't have to bend over and put them on. You can just slip them on. And they give good support. They have laces on them, which you can pre-tie, and they'll always be the same. And they actually have a backing to offer the support. With neuropathy, you may have sores on your feet that you can't feel and are not healing, which may become infected. This has been known to lead to amputations. You'll need to have your feet checked more often, either by yourself, a family member, or a professional to keep your feet healthy. A lot of people don't realize they have injured themselves until they've seen blood on the bathroom floor. Use a hand mirror, or if you have a vision problem, have someone else check them for you.
As far as, you can buy anything online these days, right?
Right.
What's your advice as far as buying specialty shoes online versus actually going in person and getting it fitted properly?
Well, actually, I have problem feet. My feet are wide and small. So I actually usually get 3 pairs of the same shoe in different sizes. So I get a size 6 wide, a 6.5, and a 6.5 wide. So I try them on, and the ones that are most appropriate, I keep. And then I send the other 2 back.
Yeah.
So I advise anybody who has to buy shoes online to take a similar approach. Check the small print of the company that you're using so you don't get charged a restock fee, and get them accordingly. You don't want your shoes to slip. You want them to be roomy enough that if you're going to wear socks in them, that it will be able to accommodate the socks, and or special bracing.
Makes sense, makes
So your
sense.
size 8 shoe, that might fit your foot perfectly. If you wear a brace, you may look at something like an extra wide or something like that to accommodate.
Okay, thank you. That makes sense. That makes sense.
Next, I'd like to talk about blood flow and your feet. The two main areas in that feed your tissues in your feet are your veins and your arteries. Arteries bring fresh blood to your tissues. Your veins take it away, use blood to be refreshed. Issues with blood flow can happen to your feet in both areas. Your feet are the furthest from your heart. As blood flows through your arteries to your feet, they get smaller and smaller. Arteries that are young and healthy are like flexible garden hoses. Diseases like diabetes and coronary artery disease and behaviors like smoking build up sediment or plaque within the arteries, making them rigid and more narrow, sometimes blocking the flow to an area of the body altogether. This is evident when the feet turn a darkened purple color when standing and lightening up when lifted. Also, pain can happen in the calves of the legs when walking or at night when the legs are up in the bed. What I see most often is wounds on feet or toes that do not heal. The problem is complicated, usually with a loss of feeling in the foot and shoes that have rubbed the area, preventing it from healing. On the other hand, the blood returns to the heart through the veins. One of the first signs there is a problem with your veins is swelling in your feet and ankles by the end of the day, but it is not there in the morning. This swelling can be controlled using compression stockings. But what if you can't put them on? There's stocking donning aids, as well as other forms of compression, such as compression sleeves and Velcro compression devices. Why do I bring this up? Your shoes need to accommodate for the swelling. Otherwise, you can get sores on your feet, especially if you have a loss of feeling in your feet. When your feet swell inside the shoes and there's nowhere for the swelling to go. Next. So what do? With veins, you elevate your legs when you sit. You wear the compression stockings. Diuretics don't always help the problem. Diuretics are usually used to decrease the all-over fluid in your body. Swelling in your lower legs is a separate problem altogether. If the swelling is significant, or if you've developed sores on your legs, you may need to seek help from a vascular surgeon. For arterial problems, the main thing to do is to stop smoking. Increase your walking, which increases new arteries that will form. Report to your provider purple toes that don't pink up. Also, sores that will not heal. Wear soft, comfortable shoes. And again, if the problem gets too advanced, seek the help from a vascular surgeon. The problem is once we have problems with both our veins and our arteries, there is no cure. Your vascular system will never be 20 again. So that's why taking care of it now would be the best option that you have. Surgical intervention includes, for arterial problems, angioplasties or stenting, and ultimately bypass surgery, similar that you've heard with cardiac surgery. But again, it's not a cure. For vein problems, you can have vein ligations or ablations or scleroting of incompetent veins. Again, no cure, just maintenance. Next. So common foot problems that we see mainly are fungus. There's athlete's foot. The picture on the left shows a typical moccasin pattern. It goes all the way around the foot and it's easy to treat. The picture on the right shows advanced toenail fungus, not so easy to treat. Next. Common athlete's foot is usually peeling skin, red, rash, and it can or cannot be itchy. Next. So what to do? Keep your feet clean and dry, especially between the toes. If your feet sweat, change your socks to keep dry. Use antifungal sprays, creams, or powders according to the manufacturer's instructions. Treat your shoes also. Wear shower shoes in gym showers. Treat shower stalls either in the gym or at home with 1 part bleach and 10 parts water solution between showers and between other people using the shower. Athlete's foot and toe fungus is catchy. Treat up to 2 weeks after the symptoms are gone. If the itch and the rash does not begin to go away after 2 weeks, you may need to see a provider. Next. Toenail fungus. So toenail fungus, you can see how it invaded the corner of the nail and took over. It can be caused by dermatophytes, molds, or yeasts. It is contagious, but not fatal, and it is very difficult to treat. Unfortunately, a lot of insurers do not cover treatment. They consider it cosmetic. You want to try to get rid of it before it advances. You need to be persistent and consistent. It may take up to a year to get rid of toenail fungus. Next. So, what can you do? There are some topical applications such as Penlac, nail lacquer, or Cycloprex. Both are by prescription only. You need to apply it nightly for 48 weeks. There is a 29 to 47% cure rate over 1 year. Skipped doses may allow for reinfection, and it may come back. There are oral medications. The most common is Lamisil. It's by prescription only. It's expensive, and it can cause a rise in liver enzymes and need regular blood tests during treatment. There is an 80 to 94% cure rate over 4 to 6 months of treatment, and the fungus may come back. Any of my patients over 55 years of age, I do not recommend using the oral medications, mainly because there are a lot of other things that are vying for your liver's time, and liver toxicity should not be one of the things that you'd like to have. Next. There are other treatments. There's over-the-counter treatments that usually state for skin only and not nails. 2 things that you may have heard of is one's called Fungi Nail, and the other is called Carousel. There's laser treatments. Not all podiatry or areas have them. It takes up to 4 months for the fungus to go away, and it's costly and it's not covered by insurance. Treat early. Do not let that spread to other toes. Next line. Now the urban legends with some positive results. This is always fun. There are some anecdotal evidence that things such as vinegar, either apple cider vinegar or white vinegar, use half strength. You do a soak on the affected toes for 15 minutes daily. Listerine, the original brown, also half strength, soak for 15 minutes daily. Vicks Vapor Rub, of all things, because of the camphor and the eucalyptus, apply to the affected toenails daily. Snake root extract has the most promising results. It's actually an antifungal extract made from plants in the sunflower family. You apply it to the affected area every third day for the first month, twice a week for the second month, and once a week for the third month. Next. The issue is that nail fungus starts from the top of the nail and moves downward. Your nail grows from the bottom up. So you need to keep trimming back the old nail. And you need to treat your shoes also. So this process can take up to a year. So the other thing is if it's an excellent time to re-measure your feet. You may need a whole different size shoe. If you don't treat your shoes, you can reinfect yourself. Next. People keep asking me what are the best exercises for feet. So gentle massage and stretching always helps. But the best exercise all around is walking. It stimulates the rest of your body. It stimulates blood flow to and from the lower body, and it strengthens your muscles, which helps you maintain your mobility. Next. Care of our feet. It's easy to think about this for our children and when we are able to care for ourselves. But what happens when we can't take care of our own feet? Next. When to seek help. When you can't find shoes you need, don't rely on the shoe stores to carry your size or the kind of shoes you need. Either you or your family member, friend, or health professional can Google the internet to find suitable shoes, also compare prices. Good fitting shoes shouldn't break the bank. Don't get hung up on brand names. If you can find shoes that fit your feet, that's the bonus. That's the 100%. When you can no longer cut your own toenails safely, when you have issues with mobility, vision, there may be cognitive decline. Seek help from family members, caregivers, pedicurists, foot care nurses for routine foot care. Don't wait until issues like overgrowing nails lead to pain and eventual sores and difficulty walking. Next. So when should you seek the help of a podiatrist? Podiatrists are special doctors. Some are surgeons trained in the special problems associated with foot and ankle issues. Think sports medicine with runners and ball players of all kinds that depend on their feet for agility and speed. The short answer of when to seek help from a podiatrist is anytime you feel that they can help you. However, like any doctor's office, it may take a while for an appointment and become established with the practice. I suggest to all my diabetic patients, if they do not have a podiatrist, they should get one, like a primary care provider, just in case. Routine foot care consists of cutting nails and managing corns and calluses. But once you develop an issue such as pain, foot deformities, painful corns or calluses, plantar warts that won't go away, or ingrown nails, the care is no longer routine and you need to seek additional care. When you have a chronic disease like diabetes that may need special shoe wear, orthotics, or surgery, either now or later. If you develop a chronic foot or toe deformity that may be helped by special devices or surgery, a podiatrist would be able to help. Next slide. Thank you for listening to a subject that is near and dear to my heart. Next. Any questions? I can be reached at donna@mobilemedicalfootcare.org or my phone number 781-421-8286. Thank you, Deb.
Thank you. Thank you. So, Donna, I'm just gonna go back a slide or two here. Went to seek a podiatrist. I remember when my dad was, he was seeing a podiatrist to help with his diabetes, and we would go every 3 months. But we got to a point where he really needed special attention because he kept getting ingrown toenails. So when somebody gets the ingrown toenails, are they more likely to keep getting them, or once it's corrected, it should be fine?
Well, you can have two types of ingrown toenails. One is the type that's right there at the corner. It hurts. Pressure from shoes causes irritation. If the corner of the nail pierces the skin, you can get infections in that area. One of the first things you want to do is look at the shoes that you're wearing. Are the shoes pushing the nail? Is it pushing that corner into the skin? True removal of an ingrown involves minor surgery. It involves injecting the toe with an anesthetic, putting on a small tourniquet to help prevent blood seeping in the area, and involves actually cutting down the side of the offending nail into the nail root and actually killing it so that it doesn't regrow. And once that is performed, usually 90 to 100%, the nail will not grow back and take care of the ingrown problem. That is meniscectomy. It is, as I said, it's a surgical procedure, usually performed by a podiatrist or a foot care specialist with proper training.
Oh, wonderful. Okay. So now as far as the plantar warts and calluses, how different are they? How does one know what type they have and what type of treatment they should have?
A plantar's wart is a virus.
Okay.
Usually you can tell by once it is scraped, it has small little black root endings that actually bleed. And so like most viruses, it has a shelf life of usually a couple of weeks. You can try to pare it down. You hopefully can, it will go away on its own. Usually, if not, it may have to be surgically removed because they can be painful. Calluses, on the other hand, the palms of your hands and the soles of your feet have an extra layer of cells that produce the callus. Calluses are a response to friction and shearing of a shoe or like I said, over motion, like with a ring or anything else like that. Calluses by themselves are a warning that the skin is being injured. With people who have no feeling in their feet, what happens quite frequently is you can develop an ulcer underneath the callus, and then it starts to, it blows out like a blister and starts to bleed. So the callus is only a warning. It's like a symptom of a problem. And if not taken care of, it can develop into sores.
Good to know. Now, how does okay, I'm just going to stop the screen share. Now, can you see me?
Yes.
Okay. So how do people know when to seek your assistance versus the assistance of a podiatrist versus the assistance of the local pharmacy, and they can just self-treat?
Good question. As I said, if usually if a person has a major problem, they usually cannot call a podiatrist to be seen readily. Everybody gets put on for an appointment. It may be sooner, it may be later. There's always urgent care. So it depends the nature of the problem. Bleeding always is something that you want to take a look at. have someone else take a look at it first. It may be just a simple cut on the skin. It may be a blown out callus. There may be an infection involved. The symptoms of an infection are increased warmth, redness, and swelling. So that may be enough of a problem to bring you to urgent care. Hopefully, then they can assess it. Take a culture, put you on antibiotics until you can see a podiatrist. Usually your primary care provider would be able to see you. And if it's a true foot emergency, they could then refer you to a podiatrist. Other things, like we've all had stubbed toes, we've all had lifted toenails, unfortunately, for reasons. Again, foot problems don't just occur. They occur over time. So if you've noticed issues over time, you'll be able to tell whether or not it's a, quote, emergency or not. If you've had been homebound and your nails are very long, you might have just lived with them until one of your family members takes a look and is horrified. And wants your nails cut. So it depends on what level of urgency there is.
I understand. Yeah. Thank you. Thank you. So we're almost at the top of the hour. What are one or two things that you want people to take away from your presentation?
The main thing is to start early. If you're 40 years old and watching this program, look at your shoe wear, look at your feet, make adjustments. If you smoke, stop. If you're 50 years old and have problems, again, it's never too late to start taking care of your feet. If you've neglected your toenails, it might be the time to call somebody. If you do have sores on your feet, again, it's not too late. Call somebody, your primary care. If you're a diabetic, don't have a podiatrist, call one, get on their roster, have your feet checked. It's never too late to get a proper shoe wear. It's never too late to have a full assessment, edema management for your legs, proper shoes for your feet, a vascular assessment for your arteries.
Very good. Very good. And can you briefly just mention the over-the-counter treatments that people tend to use for calluses and also for the fungal infection, because those are typically the popular ones, popular foot problems that people have, right? I think you mentioned something with uremic acid.
Urea.
Urea, okay.
Yep, urea. It's actually horse urine. It's not harmful. But what it is it's a big softening agent. You'll actually see it in a lot of creams. The problem is with some of the creams, it's just in a small amount, so it really doesn't help soften the skin. So things like the two I mentioned, Ulactin and Lachydrin, it has like 10% urea in them, and it can soften the skin. The over-the-counter callus aids, again, if you have a loss of feeling, you can actually do a lot of damage with things like the petty egg and some other callus softeners. So you use them, you have to be aware of that they can burn your skin.
Got it. And for the fungal infection, You mentioned, I think, Lamisil.
Lamisil is a pill.
Okay.
So there are creams, there are antifungal creams, and there might be an antifungal cream called Lamisil, and that's external.
Mhm.
So that would be used on there's Lotrimin, Lamisil. Those are all external antifungals, and they will help with athlete's foot.
Mhm.
The toenail fungus is a whole nother thing.
Yeah, yeah. And by the way, everybody, this is not Donna, prescribing any type of medications. These are just, what people tend to use for these type of conditions. So, none of us, both of us are not, here to prescribe. We're just kind of sharing the information of what's out there. So Donna, I really want to thank you for being on this program today. And, you've covered so much about feet and how we really need to kind of take care of them. Having our feet is made up of so many different muscles, sweat glands, and bone structures. Oh my gosh, I couldn't believe all that information that you gave us. But, it really does make sense that, uh, our feet being the furthest part from our eyes and our heart, it needs to be able to function in a way to help us walk around as smoothly as possible and also as painless as possible, right? So definitely having the proper footwear and taking good care of it is very important. So I want to thank you so much for being on the Aging Strong program. And if anybody has any questions for you, what's the best way to contact you again?
At my email address, Donna@mobilemedicalfootcare.org.
Great. Well, thank you so much. And I also want to thank the Quincy Health Department for continuing to sponsor Aging Strong. Until next time, everybody, stay healthy and be strong. Take care. Bye-bye.
Thank you. Bye.